Hello, my name is Binyam Ayel. I am a Global Atlantic Fellow for Equity and Brand Health. My research mainly focus on Alzheimer's disease and related dementia. For today, I'd like to talk about Alzheimer's disease and other dementias, which is sometimes be missed, but Alzheimer, even though Alzheimer's is the commonest cause of dementia, we do have other causes of dementia too. So I will discuss few of them at least for this session. So understanding what is Alzheimer's is and dementia, we'll see preventive strategies and also ways to live well with dementia. So when you see Alzheimer's, it's a gradual loss of brain cells. It's a neurodegenerative disease, which is basically days of neuronal synapse and its connections. So the neurons start to die. Uh, we'll come to the causes and why these neurons start to die, but mostly it is due to some abnormal protein deposition called the amyloid betas and tau tangles. So when those protein kind of clump around the neurons, tau basically will accumulate inside the neuron, amyloid kind of accumulate outside the neuron, then which subsequently resulted in days of that neuron. So when you see Alzheimer's, it's primarily starts from the area of the brain called hippocampus, interrenal cortex. Those are the initial area that's affected by Alzheimer's. Hence, mostly Alzheimer's patients initially present with memory problem because hippocampus is basically our memory center where short-term memory kind of consolidated into long-term memory. So once it's start from there and then it will spread to other parts. So as a disease progress, individuals start to have language problem, thinking problem, and even in advanced stage, it may also affect movement. So it's a progressive disease that destroys specific area of the brain initially, then progress to involve the others. So as I have said, it's mainly due to amyloid plaque and tau tangles, ultimately triggering neuronal death. But when you see in terms of dementia, Alzheimer's disease is the commonest cause of dementia, accounting almost two-thirds of all cases of dementias are due to Alzheimer's disease. Excuse me. So when you see other cause of dementia beyond Alzheimer's disease, the first one for today we'll see vascular dementia. So this is also the second most common type of dementia after Alzheimer's disease. So as the name indicates, vascular dementia, so the cause is mainly related to blood flow to specific part of the brain, whether it's a large stroke or smaller vessel diseases that causes injury to some part of the brain. So as following stroke or a smaller vessel disease, accumulation of this problem along the time will lead to memory problem, reasoning, and judgment too. So symptoms usually depend on the area where that vascular problem happens, which means where there is reduced blood flow, and then subsequently cause of neuronal death. So, but overall, it will affect our reasoning, information processing, information retrieval could be uh, significantly affected. So slow thinking, poor focus, difficulty organizing, mood change also could be there. And as progress, memory loss also could happen in advanced stage. But initially, it's more of a slow thinking. We call it mostly non-amnestic profile. Alzheimer's is initially it's much of memory problem, while vascular dementia is most initially in thinking problem, processing speed is slow, retrieval speed is slow. When you see the risk factors, These are basically risk factors that cause atherosclerosis, that are risk factor for stroke, high blood pressure, diabetes, smoking, heart disease, high cholesterol. All these things will increase the risk of atherosclerosis, which kind of narrow our blood vessels so that it will reduce blood flow to specific part of the brain and hence resulting in vascular dementia. So preventing vascular dementia will primarily focus on controlling these risk factors. Prevention or with control of blood pressure, glucose, cholesterol, regular exercise, healthy diets, especially Mediterranean diets and mind diets are very important in giving us a healthy uh, cardiovascular diseases are almost cardiovascular preventive methods are also will benefit stroke prevention as well as vascular preventive strategies. The other types of dementia is Lewy body dementia. This is compared to Alzheimer's. We talk about Alzheimer's as accumulation of amyloid and tau, while this one, Lewy body, the predominant abnormal protein that is deposited is the alpha-synuclein protein, which kind of clumped and formed Lewy body inside the neuronal cell, triggering neuronal death. So the affected region usually in Lewy body, the initial symptoms are much more of the movement features looks like Parkinsonism, and then there is a predominant behavioral, especially visual hallucinations are there. REM behavioral sleep disorders are also a common feature, which is sleep enacting, people moving their hand during sleep, during dreaming time, could be punching, be shouting, moving their hands and legs during sleep. So sleep enacting could be an earlier sign that actually indicates some of features that could suggest of Lewy body dementias. So in terms of feature, Alzheimer's, it do can sometimes coexist with Alzheimer's, some feature of Parkinson disease too. So the other very important feature of Lewy body dementia is it's kind of cognitive fluctuates. So the individual could have some sort of period of confusion followed by mental clarity, those kind of episodic confusion followed by mental clarity is what you call it cognitive fluctuation, which is a good sign that indicates individual could be suffering from Lewy body dementia. The other is frontotemporal dementia. This is, as the name also indicates, the neurodegeneration initially occurs in frontal and temporal lobes. Because of that, it will predominantly present as personality change, language problem, behavioral problem, more than memory, and especially in the earlier stage. So we see Alzheimer's, earlier stage is predominantly memory problem. While it's progress, it could involve other parts of our executive function too. So frontotemporal dementia in terms of the demography, it's affect compared to Alzheimer's, it's much younger, 45 to 65. Usually Alzheimer's is above 65, unless there is a form of Alzheimer called early onset Alzheimer's, in which there is a genetic predisposition. In that case, it could occur in less than 65 age individuals. So frontotemporal dementia is the abnormal protein that deposits in this disorder is mostly tau or TDP43